Hi guys, we're on the next video of the Maths Facts series. Today what we're going to talk about is a different way that we can help people to get over the symptoms of tennis elbow. So tennis elbow actually is more brought on by wrist movement than it is anywhere else, and it is actually an inflammation or micro tears of the wrist extensor tendons which actually originate from this lateral side of the elbow. But that is where you experience your pain. But what we want to do, as well as sort of strengthening that tendon, which you can do at home, is something different we do here in clinic. So, very simply, what we do, we have a seat belt just like this, placing it around the elbow, and gripping is one of those things which can bring on that pain. So am I going to ask Will to grip? If you had tennis elbow, you would expect to experience pain at that elbow level. What we then do is ask Will to relax slightly, and then what we do is put a slight glide at that elbow joint. And what you're doing is just changing the biomechanics of the elbow slightly. Ask Will to grip again. That should then hopefully become less painful. If there is still some pain, I'm going to ask Will to relax again, put an even more of a glide on, and again ask him to grip. Hopefully the idea now is that we've managed to get that to pain-free gripping. I'm going to ask him to repeat that 10 times. What we would then do is then have a relax for 30 seconds in between, and we would repeat that movement 3 times, doing 10 repetitions. What that's doing is very simply just changing the feedback to the brain from that elbow. So pain comes from the tendon itself, but also the nerves. And if you can change it and get positive feedback doing that movement with no pain, the idea is that then you can then take off that pressure, and actually the feedback to the brain doesn't give you that pain stimulus anymore. Thanks guys.